Let's try this really fast. Just for the fun of it, I want you guys to grab a post-it note if you have one in front of you, or grab a piece of paper. Grab a pen or a marker, it's also going to be easy. And then what I'm going to ask you is this. Without looking in a mirror, I want you to actually put the piece of paper in your forehead. This is a quick exercise, and you're going to find out why I'm asking you guys to do this. Once you have that paper in your forehead, grab the pen. It doesn't matter with your left or right, whichever you're more comfortable in. And what I want you to do now is pretend there's somebody in front of you. And I want you to go ahead and write the number 7 without looking at the paper. Keep the paper in your forehead and write the number 7. I'm going to give you about 20 seconds to do this, okay? So I'm going to turn off the mic and I want you to try it. Okay, so now I want you to grab the paper and I want you to look at the number 7 that you wrote. If you can read the number 7, it says something about you as a person. So if you can clearly see that it says number 7, then what that means is that you were thinking of the other person, that you were thinking what they're thinking. You wanted to make sure that they actually was able to read the number 7. Because I didn't tell you to write the number 7 the way the other person should read it. And if you guys have the 7 the other way around, where it's, only readable towards your area, that means you were thinking about yourself. And what this practice does, it kind of shows you as a person. It's either good or bad. Nothing really matters. But most of the time it tells us about a person who we are. So if you were thinking about the person and making sure they can see the 7, that means you're a person that thinks about the persons in front of you. And if it's the other way, that means you're thinking about yourself more. So if that's a situation where you can't read the number 7 when you've looked at it, that means you need to pay attention more to the person that you're talking to. When we are conversing with people, we have to understand, and this is a very must and a rule when we're marketing, is that they need to talk more than you. Your job is to ask questions to be able to get the answer that they need, and then respond from there. The person that talks the most in marketing is the one that's going to lose, and you want them to talk more so they lose, so that you win and you get the referral. It's just one of those different mindset thinking that's very important to know. Okay, now we're going to talk about selling and marketing. Very, very good and fun part. We want you guys to know this, that a lot of people have this stigma against selling. And when we ask a person, all right, tell me and describe to me a salesperson, most of the time is people associate salespeople with actually negative stuff. They start thinking those sleazy car salesmen, those pushy phone operators that's trying to make you buy things in the phone. Okay, so we always think about the bad aspects of selling, but this whole world, the whole universe cannot function without salespeople. That any given time, people are selling you something. If there wasn't good salespeople, will you be wearing clothes right now? Will you be wearing the right clothes? Will you have that beautiful house, or will you have that nice car? Eventually, people that really help us are salespeople, but we always attach negative aspects to salespeople. And everything that we do in life, we're selling. There's a book by Daniel Pink that really, really talked about it a lot, that really made an impact for me, was that he talked about to sell is human. And whether we're selling a commodity, whether we're selling our services, whether we're selling a car, or whether we're selling appliances, we're selling something. Parents are selling to kids the idea that they should be good, the idea that they should actually listen, that they should eat what they are given in their plates. So anything that we do is some form of selling. Another thing also in the healthcare industry is that we frown upon the word marketing. And a lot of people says, you're not marketing your home health agency. So you don't want to hire a marketer. You want to hire a liaison. You want to hire a community outreach director. They have all these different positions, names of positions, yet it means the same exact thing. You are a salesperson. You're selling a product which is you and your company, and you want them to buy from you and use your product. So the sooner we agree, the sooner that we can get it in your head that you are selling and it is not a negative thing, the easier we can move on to the next level of success. So I want you guys to understand that. And what I want you to do is I want to be able to give you guys some aspects and takeaways and some advices in regards to what are great marketers. So look, as an agency or as a marketer for an agency, what 3 things did you do this week that got you a referral? Name them for me and make a comment, okay? So I want you guys to think about what have you done this week alone that is going to get you business. Now, there's going to be some people here that says, well, Michael, we haven't really started our company yet. We're in the beginning process of our company, so we're not really thinking about marketing yet. I want you guys to reverse your thinking and start realizing that just because you're waiting for your license, just because you're waiting for a few paperworks, that doesn't mean that you don't start marketing your company. Are you guys on LinkedIn starting to link in with people? Are you actually going to networking events already to start, at least meeting people and creating relationships? Are you scouring the internet and grabbing information of the people that you want to talk to? Are you gathering all the names of the doctors that would be potential referral sources? Are you starting to map out your visitation routes for these places? Have you actually gathered the addresses, the emails, put it in an Excel sheet, and started making your labels? Because eventually you're going to have to make those to do mailers. So just because if you tell me and you give me an objection, you say, Michael, we're just starting off and we haven't things straight on out yet, and we're going to do that eventually once we have our license. No, start now, get the small stuff out of the way, and start winning. Now, for you guys who's actually been working already, who's had your license, but want more success, what have you done this week? 3 things. Have you called any physicians, okay, that you don't know, that you never knew, and try to set up an appointment? And don't tell me just one, it has to be more than 30. And that's just minimum. Okay, have you actually put out mailers? Have you sent out multiple emails? Have you actually done any blogging this week to start getting the word out? Did you post any interesting things in LinkedIn and YouTube and Facebook? What have you done that can generate buzz for people to actually look into you? Being able to market your company and sell them on the notion of referring you patients is critical. How great are you at getting people to refer patients to your agency? If I ask you between a rating of 1 to 10, how good do you think you are to get referrals? Give me a number. Think about it. Most people say a 7, okay? So if you're a 7, that's great. What can we do to make it an 8? What can we do to make it a 9? If it's below a 7, what actions can you start right now that will slowly improve you and get you to a 7 and then eventually a 9? Nobody should be a 10 because you can always do more than what you're doing.